Hi, everyone. It's Mary Alice Haney.
And Dr. Thais Aliabadi.
We talk to so many women in our SheMD community who are just done. They're doing the workouts, they're eating the right things, but they're still hitting that 3 p.m. wall, dealing with brain fog and feeling like their body is working against them.
As an OBGYN, I see this every single day. Women are told they're just getting older or they're stressed. But the truth is, your metabolism is your body's master regulator. You don't need another caffeine fix. You need to support the system that powers you.
That's why we created Ovi. We weren't looking for a quick fix or a miracle pill. We wanted a real doctor-formulated solution for complete metabolic care.
We built Ovi to the Ovi standard. No proprietary blends, no fillers, just clinically studied ingredients. It's designed to help your body manage blood sugar spikes and stay in a steady, high energy state all day long.
And it's the easiest part of my morning. No more giant pill organizers, just one simple ritual.
Real metabolic support isn't a quick fix. It's a phased journey. Give your body 90 days to start, feel, and see the sync.
It's time to get your spark back. Head to ovi.com to start your 90-day metabolic reset today. Use code SheMD at checkout to save 10% off your order. That's ovii.com. Your body will thank you. Hi. So on today's podcast, we have one of my best friends in the entire world, Alicia White. And I have been talking to her for a really long time about autoimmune and Lyme's disease and sort of the work that she has done around it. She's the founder of thetickchicks.com. And I'm going to have her tell her amazing story. And I said, I really want to talk about this. You can't turn a corner and have a mom say, "Oh, I'm worried about Lyme's disease." Even my kids, and they're looking on TikTok and all this. And my son was like, "Will you look through my hair?" So especially in summer, it's such a big topic. And I said, I want to bring a great expert on Lyme's disease and autoimmune and sort of all of these issues that we have as women, and they could be obviously caused from several different things. Lyme's disease is just one of them. And so she said, well, you got to talk to Dr. Kat, as she's known, Dr. Kathleen King. And so that's why we're here. So hi, guys. Welcome.
Hi.
Hello. Alicia, can we start by just kind of going through your journey with Lyme's disease and autoimmune and getting to a place where you are now to be able to help other women who've suffered through this?
Of course. Yeah. Thank you for having me. I'm thrilled to be here. I'm not unlike a lot of other people out there. You've been reading about it in the headlines. Lyme disease claims 476,000 new cases in the United States alone. So it's a hot topic. And, why is this happening? Basically, ER visits are skyrocketing. And 2025 showed the highest level since 2019 nationwide. And the spike is attributed to record high tick populations. There's longer seasons due to climate change. A lot more people are becoming aware and hypervigilant, so they will go quickly to the ER. And human expansion into areas, that are into forests. Our cities are going out into the forests now, the Hamptons, everywhere. It's just more of an issue now than it ever has been. And then some variants of ticks are more aggressive and so are their symptoms. So they're getting to the ER a lot faster. My journey in a nutshell was that, I was one of those people, and I vacationed in a place that's endemic to Lyme disease. And then I came back home and it was about a month later and I started having neurological symptoms. And this can be oftentimes the first symptom. But the problem was I was in California, and there's not a lot of Lyme literate doctors in California. So the specialists I was going to never bothered to ask me where I had traveled. So it took me, with the best insurance possible, 6 years to get properly diagnosed. I had mystery symptoms. It's a very complex disease. And basically what it happens is your body goes into this sort of shock and systemic breakdown once the bacteria enters your bloodstream. So it's neurological, it's problems with your joints, muscles. I had burning pain all over. It's a neurological pain and debilitating fatigue. And that's how I lived my life for 6 years. Once I finally got correctly diagnosed, I felt good about that. And I at least had a direction. And, my journey for the next 6 years was all about never giving up, being relentless, and getting to a point where I was really healthy again. I can now say I've healed myself from Lyme disease. And so, that's why I formed the tickchicks.com. And that's why I love working with Dr. Kat, because together we can help people manage this, know what to look for, know how to properly prevent a tick bite, and what to do if you do get bit by a tick.
Well, so just basic, and I've had so many friends that have Lyme's disease. One of my friends from New York, who her whole life she spent in the Hamptons, she woke up one day and couldn't walk. I mean, it was this, these various from, feeling bad to having neurological symptoms. So what are the main symptoms that you should look out for if you think you might have Lyme disease? But my question is, it's so hard to diagnose an autoimmune. It's so hard to diagnose between Lyme's disease and other autoimmune. And a lot of times somebody gets diagnosed for Lyme's disease, but they don't have it and they're getting treated for Lyme's disease. So how, somebody listening, how do you get the right diagnosis?
There are really two great labs. One is called IGeneX Lab. And like I mentioned before, they are specializing in tick-borne illness only. And then there's another one called Vibrant Labs. That's a little more affordable, and they'll test for the major ones that we see here in the United States. But if you've traveled all over the world, you may not really be picking up on some of the other things that IGeneX Labs will pick up on. So the best way to test for Lyme is to go to one of the reputable labs that does a blood draw, and it is a beautiful printout of every single thing. And I know this, and yes, there's a fine line between Hashimoto's, lupus, MS, and Lyme disease. What I'm advocating for is for those doctors, when they're testing a patient, I got tested for all those things. When they're testing me for the big 7, they never once tested for Lyme disease,
Wow.
which was a huge disservice to me. And to be turned away into saying, I guess it's a pain disorder from my neurologist is not okay. And so that is what I'm just just stick the Lyme disease test in there now. That can differentiate me from a Hashimoto's patient or, a lupus patient or an MS patient. There are so many similarities between Lyme disease and MS. There's so many misdiagnoses. And so you have to be very vigilant and very specific with your doctors in what tests you ask for. And you have to go to a Lyme literate physician that's been given the extra training from maybe ILADS or one of those conferences that they can go to get extra training in this actual category to properly diagnose Lyme. Lyme disease is one strain, and it can affect people mostly neurologically, I would say. But keep in mind, with every tick bite, you're basically inviting up to 10 to 12 to 20 types of co-infections. So many of those that are prevalent in the United States have their own symptoms and their own treatments. So for instance, if you get babesiosis with the tick bite, you could have air hunger, which is a shallow breathing, a kind of a chest manifestation. If you get Bartonella, which is one of the things I had along with Lyme, it affected my feet. And I woke up one day, just like your friend, and couldn't walk on my feet. I thought I had broken something in my foot. I went to the ER. It was that painful, but I literally woke up with it like that. Alpha-gal is very prevalent in the Midwest right now. And if you get bit by a tick carrying the alpha-gal protein and it spikes into your own protein, then guess what? You wake up and you're immediately allergic. anaphylactically allergic to red meat and all mammal products. And this is on the rise right now in the Midwest. And it is very, very acute, and it is aggressive, and it doesn't not have a cure. So you may not eat anything that's related to a mammal after that. If you have Ehrlichia, I've also had that as one of my co-infections. You just wake up after a tick bite about 48 hours, 24 to 48 hours after that, and you think you might have COVID. It's a very flu-like symptom, very flu-like symptoms. And all of these you need to treat immediately. If you see a tick on you, you have to treat that within 24 hours. That's really imperative, and that's what all the experts agree upon across the board.
So the protocol is you see you have a tick. This is before the symptoms even happen. What is the treatment?
I mean, first of all, if you see a tick crawling on you, it doesn't necessarily mean that it's bitten you. So I wouldn't. Step number one is don't panic.
Okay, I would panic. Okay, just put panic in there. I would totally panic.
It's a bug, and if it's embedded in you, that's another thing, because panic does set in a little bit. But there are a lot of ticks out there that don't carry anything. So I just want everybody to understand that. And different ticks carry different diseases, so you just don't need to just panic. But most people don't recall being bitten, because when the tick attaches, it releases a numbing agent into your skin. And so it's very rare that somebody feels themselves actually being bit. But what you do is I have these devices at thetickchicks.com, but you would get a device kind of like this. It's a flat tweezer. You go into the base right where it's attached and pull straight up. And then you put that in a Ziploc baggie. And I'll show you one that I recently, if you can just even see, well, you can't really even see it, but it's a tiny, 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 the size less than a poppy seed. It's so tiny. And those are the most aggressive ones, the nymph ticks that carry the most heavy viral load. So you put it in a Ziploc like that, and then you send the tick off for testing.
Where do you send it for testing?
You can send it to tickreport.com, or you can send it to Igenix Labs. They're the only tick lab in the United States, and they specialize in knowing exactly what that tick was carrying at that exact time. And if you just send that tick in for $100, you're going to save yourself a lot of sweat and tears later on down the road.
And then what was the antibiotic you just showed us? So
and
listeners, if you're not watching it,
yeah. If you see a tick on you and you pull it off, now the CDC is actually recommending, if you're suspicious, meaning it's looking suspicious, you're in an endemic area, maybe you've had tick-borne illness in the past, this is key within 24 hours. You have to get on doxycycline within the first 24 hours to 48 hours as soon as you can get your hands on some. I always keep some in my house at the lake. Mm-hmm. But after, because Lyme disease and some of these co-infections can get into your system, and they burrow in like a corkscrew into your muscles, tendons, joints, brain, everything, your heart. They can go in a million different directions. So then at that point, after a certain amount of time, you may experience chronic Lyme disease, which is called post-treatment Lyme disease.
And how do you treat that?
And that's the $1 million question, because that's the majority of people who I meet and talk to, and Dr. Kathleen too. We've now entered into the chronic illness systemic breakdown world where it's like long COVID. It just doesn't quite go away. And you are left with a lifelong scarring of, maybe it's brain fog, maybe it's the inability to walk properly. Maybe, there's just a host of different ways that it can look. But basically with any chronic illness, it's about getting yourself out of that hole. And that's what we specialize in, really, is offering motivation, support, and treatments and recommendations for treatments. And there's no cure. So you're just going to have to take a holistic approach to getting this out of your body and working past it. It will combine your mind, body, and spirit. You may not need conventional medication after that acute state, because conventional medicine is not proven to be a cure past that acute stage. So once it enters chronic, you're going to have to really pull your pants up and get to work and really have grace with yourself. It can take years to come out of that.
So on this journey that you met Dr. Kat and Dr. Kat, I would love you to just sort of talk about what your work is, and she sort of was instrumental in helping you in this 360 approach to trying to heal yourself.
Yeah, I had done all the things. I went on a 3-month course of antibiotics. By the time I realized it was Lyme disease, I was in the chronic phase, and that was too bad, but I had to dig myself out. So I made a lot of different changes in my life. Once I realized that conventional medicine was actually shredding my gut and not doing much to help my immune system, I did herbal protocols. I did infrared. I got an integrative MD immediately. I joined a community. I did integrative medicine to help my symptom control, which would have been IV vitamins, rest, frequency, whether it's light magnets, sound, vibration, frequency, ozone therapy, SOT treatment. I did it all. And that's why I think that I was able to get myself a little bit better. I want to mention that the tick carries its own viral load. So a lot of it has to do with the actual tick that bit you. But my final piece of the puzzle was letting go. My body had been so tight and rigid, and my mind, I didn't even want to go outside. I was like rigid. I hadn't been able to exercise because with Lyme disease, once you exercise, you go back about 10 steps. And I didn't, I'd go out in the humidity and I'd go back about 10 steps, and I just couldn't. So I was so chronically in fear that I would put my body back where it was, that my body was actually preventing me from healing that last step of the journey. And I sought Dr. King out because she's one of the very, very best in the nation. She will not brag about herself, but she's so good. And I grabbed onto her and I said, I think my mind is the last piece of the puzzle. I think that vagus nerve was so tight. And basically, I wanted her to bring her on in case people are listening and they're in the chronic stage of Lyme disease, how the mind-body connection works and how you can heal that final piece of the puzzle.
Before we move on to Dr. Kat, so when you were in that chronic phase, what were your symptoms? Like, what was happening to your body? You said you couldn't couldn't exercise. And is that something that happens with all Lyme disease? Like, once you're not supposed to exercise? Is that part of it?
It's not that. It's just that you develop your body, your baseline body is not anywhere near where it used to be. So you can walk around, you kind of look normal, and you can do maybe 1 or 2 things a week. When I was in that chronic stage, I would say I would be in bed basically the whole week to go out for 2 hours on Saturday night just to feel like I had some sense of, I wouldn't go crazy, but then it was just back in bed. So you basically develop these intolerances. You develop an intolerance to exercise, to heat, to altitude, to barometric pressures, to chemicals in your house. The smell of them can send you into a whole spiral. You are so sensitive, Mary Alice, that you cannot live your life. And that's the kind of trauma that I'm talking about mentally. You feel like you're an alien, basically, walking around trying to live life normally, and you just can't. So you develop a whole host of intolerances, and that is what you're trying very carefully to get out of. You're even, intolerant to things that help you, like infrared sauna, for instance. You just have to take baby steps in order to come out of that.
And is that for every strain of Lyme disease, or is that just different things for different strains?
Well, and Dr. Kat can talk about this too because she's had Lyme, but I would say that every person I've ever spoken with, and I have a lot of followers and a lot of people that ask me DMs and chronicle their journey with me, everybody goes through this period.
So I think for a long time, for autoimmune in general, especially women, we were dismissed. We were told, whether it was Lyme's disease or do you consider Lyme disease an autoimmune disease?
Yes, but it also can be reversed.
Okay. So, but Hashimoto's, I mean, you kind of name it, women were told, that's not a thing. Chronic fatigue. Nope, that's not a thing. Like so I think now we're starting to think about that differently in the media. And I think social media is great. And, these people that come out publicly and say, this is real, this is happening to me. That's super important.
And I will just throw this in there. If you're doing everything right, and you have Lyme disease, and you've done the lifestyle changes, you've done the conventional medicine, you've done the integrative medicine, you're trying. Mold illness is closely related to Lyme disease, and you could be in a mold environment without knowing it. Maybe it's hidden, and you will never ever get better if you were in that environment, whether it's in your school, work, or home. And, I can
Are there tests to test for mold? I mean, so there's an actual Lyme's disease test that will test for Lyme's disease in all the strains, right, Alicia?
And all the co-infections, yes.
Okay, great. And all the co-infections. How do you test for mold?
So there's two ways. If you think you're in a moldy environment, you have to actually have an environmentalist company come out. My daughter had this. Her apartment was brand new, sparkling. I finally said, after she got diagnosed with Hashimoto's, and now they're linking that to mold illness, I said, let's just get a company in here, because I was tired of her being sick so much. I was like, let's get to the root cause. And then they photographed the ceilings and the walls. They took air samples, and lo and behold, in the thermographic photographs, above her bed was about a 5-foot ring on the other side of the drywall that just looked like a black ring above her bed. And, but knowing that, we could say then, okay, now we can possibly turn the Hashimoto's around and get her back to 100% health. But the other thing is if you've been in a moldy environment for years and years, and maybe even not that long, but chronic mold infestation in your living space or workspace, you can move out of that apartment and still harbor mold illness in your system, blood, urine, blah, blah, blah. So you'd have to go and get a mold illness test. And that is, I believe, a simple urine test from one of the labs. It's very easy to diagnose. The treatment can last anywhere from 6 months to a year to properly treat and get rid of mold illness in the body.
Dr. Kat, so tell us about your work with Lyme's disease, with autoimmune. I mean, one of the things that I found so interesting was that the intersection of Lyme's disease and nervous system deregulation represents a growing area of clinical understanding. And there was some research that says Borrelia burgdorferi, and I know I didn't say that right. Did I say it right? Did I say it right?
You're almost there, yeah.
I'm almost there. I'm getting there. The bacteria responsible for Lyme's disease can cross the blood-brain barrier and directly affect neurological function, leading to symptoms often diagnosed as psychiatric conditions. This, they say that studies have showed that up to 40% of Lyme's patients have been told that this is a psychiatric thing. Mm-hmm. This isn't a, so I always say it's not in our head, it's in our body. That's, we're kind of always told that as women. So can you talk about your experience with Lyme's disease, autoimmune, and what your work is?
Well, much like Allie was saying, there was a lot of misdiagnosis. And just like you were saying, the first thing a doctor gave me was an antacid and an anti-anxiety pill. So that was what was wrong. And so that's really how it begins. It's like, oh, you're, and for a lot of people, a pain pill. And that's the end of it until they find somebody who is Lyme literate. So I went from doctor to doctor. And I tried lots of protocols. And like Allie was saying, you end up developing intolerances. So part of the disease is it's an amazing survival mechanism where anything that would actually help your body discharge, sometimes you can become intolerant to that. And so what do you do if protocols aren't even working, or you can't do the infrared sauna, or you can't take supplements, you can't eat the healthy foods? And that's really the place I got to, is I was so sick, nothing was working. I was seeing the best doctors in the world. I finally got my Lyme diagnosis along with some other things and other co-infections, but nothing was working for me. I was too intolerant. And fortunately, I have a background being a physical therapist, and I worked with chronic pain. So I worked with mind-body syndrome and the nervous system as it relates to pain. And I decided, what if this Lyme diagnosis has more to do with the nervous system and the brain than I've been told? So this was, almost 10 years ago, where I started having these kind of thoughts. And I started experimenting with my physical therapy exercises for chronic pain. I did not have chronic pain like Allie did. I had other sorts of neurological issues, but it started to work, and I wasn't treating, and I wasn't doing the diet or the supplement. I was focusing on my brain and nervous system. And I realized that what happens with this whole epidemic is it's not just a bacteria and a pathogen that we need to focus on. It's literally a whole nervous system scrambling. And it's a reinforced system where both the nervous system keeps the immune system confused, and the pathogens in the body stimulate the nervous system and jack up the nervous system response. So it's really a tailspin. And I found that for me, and now for many others, if you can really get in there and hack the nervous system, the brain, and deal with the other things that are stressing the nervous system, like trauma, lifestyle, your beliefs, you can decrease the threshold of the overall stress in the body. And that gives the body more space to now be discerning as to how to ramp a proper immune response, how to detoxify, how to regulate the endocrine system. And really, the body just needs space and capacity to do its job, which is why a lot of people do get bit with ticks and their body handles it, because their body had the capacity for whatever reason they did, and other people's don't. So you have to build capacity in the nervous system to handle Lyme disease and the co-infections. And some people, they build enough capacity that they heal without anything. And a lot of people heal with things as well. I've seen both paths, but ultimately it is through Olympic athlete training of the autonomic nervous system and the brain, and a true dedication to decrease that full stress bucket that most people have that is needed to heal from Lyme.
Okay, so I love so many things that you just said. I want to know how you hack your nervous system. So we're going to learn about that, because I think it's true for, for women and anxiety, and ADD, they can sort of be misdiagnosed, and it's sort of like all of that happens. You've got women with autoimmune diseases, you've got women with Lyme disease, you've got women who are suffering from breast cancer, you've got women, like you said, the trauma of it all. Alicia, you were in a trauma spiral in terms of the way that your body was reacting to the Lymes, but you've worked with trauma and resetting that, Dr. Kat, for a really long time, and taking that information and that that knowledge and helping someone with chronic disease is amazing. So I don't care if you have Lyme's disease. I don't care, if you're just going through a bad breakup. I don't care, what's going on. I think everybody would love to know, how do you hack your nervous system?
Yeah. Well, I agree. I think it's really lifestyle medicine for everyone, and should be learning this in kindergarten because of the way that we're living. And I actually just want to say real quick that I think part of the setup for this epidemic, not just for Lyme, but autoimmune and all of the things, is that our nervous system is maxed now. We are on these all the time. We're on computers all the time. We spend very little time in nature or with quiet time, or just simply sitting with our family and talking, that we're not able to discharge the stress of the day. And we used to, 10 years ago was a different time, 20 years
Yeah.
ago was a different time, where we had more spaciousness to discharge what was happening, to feel the feels, because we weren't constantly on the phone. And so the first thing is that you have to create the space in your life to do the practices and to feel and to become aware of what your unconscious habits are. So the first step of hacking the nervous system, the practice I teach everyone, including in my program, is something called an awareness pattern interrupt. Be here. And if you look at neuroplasticity exercises and rewiring the brain, it almost always starts with some type of pattern interrupt, which is where you go from having an unconscious habit or thought pattern to becoming conscious and interrupting that. So for me, multiple times of the day, I just stop, I look up, and I just pay attention. What was I thinking? Was I ruminating? What am I feeling in my body? Am I clenching? Am I not even breathing? Am I rushing? Am I typing too fast? What am I doing? And then just a breath of like, be here now. look around. Just a one conscious moment that might last 10 seconds to 30 seconds is a pattern interrupt in the way our brain is processing and in the way our autonomic nervous system is processing. Literally in just a few breaths, you can shift that autonomic response into more of a parasympathetic rest and digest mode. So hacking is really about conscious attention to how you're thinking, how you're feeling, how you're behaving, and making space through the day to shift your stress response, to question the thoughts in your head that you're just having allegiance to feel the emotion in your body, to allow it to percolate up and discharge. That would be the beginning of hacking the nervous system.
So I woke up this morning and my day is like this, as
Yeah.
most women's are. It's this, waking up, I also have, these two companies. So I'm checking emails. I'm getting my child off to school. Then I'm getting my hair blown out because I have this podcast, but I have a meeting on the phone and my earbuds aren't working. So I'm like running upstairs with my hair collar on, and because I was and my thought is like, oh my God, I'm so stressed. I'm so stressed. I'm so anxious. I can't continue to do this at this level. I can't, and then Alicia, when she had her Lyme disease, she is thinking, oh my God, my body's not working. My body's not working. My body's not working.
Yeah.
Those are two totally different examples, but I think every woman has maybe the one on, mine, and hopefully not so many have the one that Alicia had to go through. But so what happens? You're sitting there, Alicia's saying, my body's not working. My body's not working. I'm saying, I'm not going to survive the stress. I'm not going to survive the stress. You stop. So walk me through that.
Yeah. Well, I just want to say it comes down to the answer to this question that I have people ask. Take a moment and ask yourself, is what I'm thinking and feeling a sense of okayness or a sense of lack, not enough, need to control, whatever? The need of the nervous system is, I am okay. It comes down to that. I'm okay. This is okay. So in other words, you could be as busy as you are. And if there's this underlying, like, yeah, I've got this, I'm okay. The nervous system is like, you are working with your nervous system. If you're in chronic illness and you have these symptoms and you're able to like tap into like, I'm okay even with this, the nervous system can rebalance. So it's not what you're doing and it's not the sickness. So I want to point that out. It's the way that we react to the reality we have. So the first step is just like, oh, wow, I am in resistance to what is happening right now. And I need to turn that resistance around. And so for you, like you're busy, you might have to say like, okay, for the next few hours, I have a plan that I need to do. And you know what? I am seeing that there's this break later today for a half hour, and I am going to nourish the heck out of myself in that 30 minutes. And so you kind of get on board. You take a conscious break to get your whole nervous system on board with the fact you have to be busy so that you're not in resistance to it. So even though you didn't just sit there and do an hour meditation and breath work, you've literally shifted the system into, I'm not okay, to I'm choosing this. And I'm going to give myself this rest later. That would be another example, because a lot of us think, well, we have to cancel our life. And it's true. We need to, I would say, look at your day and time plan a little more spaciously. But more importantly, it's this pattern interrupt of, am I resisting what's happening? And how can I get on board with this present moment so that my energy is not going in two different directions? And it might be for you, like literally, okay, I'm going to take one breath in. So the physiological sigh that Andrew Huberman teaches is a great pattern interrupt down regulation. So for you, I would like rush up the top of the stairs and be like, oh, pattern interrupt, physiological sigh. Breathe in. One more breath in. Exhale. We'll do it one more time. Again. His research has shown that breath right there is one of the quickest ways to shift into a parasympathetic state. And then from that moment of breath, you're going to have to get yourself consciously aligned with what you've just signed up for. Like, okay, I've got this. and here's the end in sight, and this is when I'm going to take care of myself. So all parts of you, all of your inner child and all those other parts, you're
Mhm.
going to be like, don't worry, I'm going to take care of you here. And there's a plan of rest instead of like, oh my God, this is never going to stop. Does that make sense? As far as
Yeah,
the
totally makes sense.
yeah.
And I think we just forget, to be kind to ourselves in that way. So, Alicia, when you went through this and you couldn't get out of bed for weeks on end, you found Dr. Cat. Like, how did you guys start to get yourself out of that place?
Well, I can just say for myself, was I was so confused of what was going on with my body that I wanted the medical diagnosis first. So I was chasing the
Yeah.
doctors. I was chasing the diagnosis. I was chasing. I didn't feel like I had time to really calm myself down. I was like, no, this is not right. It's not fibromyalgia or a pain disorder. I was so amped. I just needed the answer.
Yeah.
And then once I finally did get the answer, that's when I started with the brain retraining, because I had my answer. It wasn't the greatest answer, but that was how I learned that I had to stop the ruminating thoughts of
Yeah.
chasing the answer.
So, Dr. Cat, what's the protocol and how do you start? And having someone listening that can't come see you, um, do that within their own life.
Yeah. And it comes back to pretty much everyone on this path at some point. There's a shift from I need to fix this to I need to shift what is happening inside of me so that I can change the momentum here. And, for me, again, I was also bedbound for basically about 10 years. I was very ill. And my shift was, wow, okay, nothing is working. I felt hopeless, but I had these two kids that needed me. And I was like, I've got to be able to in some way show up for them. And I have to get out of this like hell in my head about the fear that I'm never going to get better. And I always tell people this. I had to get in touch with my values and find a way to live my values even with the suffering, so that at the end of that day, in some way, I felt like I had a piece of life happening despite the hell. And that piece of life, for me, one of my values was nature. And so I spent time outside with my kids, laying in the grass, looking for four-leaf clovers and feeling like, okay, I'm connecting with them in nature, living my values. And at the end of the day, instead of like, oh my God, what's wrong? What's wrong? I lived today. I did something that mattered. I connected with someone I loved. And there was like this spark of, I need to find a way to do things that fill me with a spark despite my limitations. In other words, like this tensions of the opposites, the suffering and the spark of life. I needed to have both in a day. And so we teach people how to reorient their consciousness to find those sparks, whether it's a beautiful brain retraining practice or some type of breathing practice that fills them with calm, or a simple walk in nature and looking at birds, or a piece of art. But they need to find a way to bring in life force, which sends a signal of a little more safety. And over time, you walk through any trauma by having found a little bit of beauty in the rubble every day, more and more. And the autonomic nervous system, when it starts to feel like it's not all horrible, when it starts to get these glimmers, we call them glimmers in the day, there's a shift that happens. It's pretty profound in our stress response, in our ability to detoxify, in the way the immune system comes online, the way the blood sugars regulate through the day. It seems like little things, but it starts to turn the ship around in a slightly different direction. And people think, well, how can those little things really heal my very real illness? Or you don't understand how big the trauma is. And I say, no, but what we're doing is we're building your capacity to hold it all, a little bit, day by day. So my capacity to hold the suffering, to hold the loss, to hold the symptoms got bigger and bigger. And so, like I said at the beginning, more space got created in my nervous system. That space allowed my autonomic functions, my endocrine system, etc., to function a little bit better. I started optimizing despite having the load of pathogens. That optimization over time shift my biochemistry. And then you start to notice like, oh, I'm actually getting better doing these things. And then this momentum takes over, and life becomes more hopeful because you start to see there's just the shift that happens, and you're like, wow, these little glimmers, they really add up, and we don't give them enough credit. The absolute profound effect of adding little glimmers in our life and its function on the endocrine system, on the digestive system, on the immune system. And so, patients come in and they often get so disempowered that they have to find all of their healing outside of themselves and in the medicine and the diets and all these things. But there is this inside medicine that over time builds a beautiful momentum if you stick with it. And if you start getting that, you have to sort of find a conviction that it's worth that it's worth it as well, which at first is a leap of faith, because you don't feel like feeling joy when you're stuck on the couch in pain. And that's really what we're changing. The messages we're changing. We're like, actually, these moments, these brain retraining practices, the nervous system practices, living your values, the artwork, the journaling, it makes a difference, and people are healing doing it. So
So let's talk about some of those. So how
yeah,
do you brain retrain?
yeah,
What are some of the things that you do what are
yeah,
some of the things that you do with every patient that comes in? They've got trauma, they've got Lyme's disease, they've
yeah,
got an autoimmune disease. How do they start?
yeah. Every patient, first of all, gets a different scientific understanding of what's happening. They're full of diagnosis, and they're not full of nervous system education to help them understand that they also have the power to shift their own immune system, endocrine system, digestive system. So part of brain retraining is a new program of how the body operates and where your power is. And that's step one. I teach a lot of the science behind the immune system and the nervous system, and why doing these silly practices make a difference. Because if a lot of people don't understand that science, they're not going to do them. They're like,
Right.
these are silly. So education. And then the next piece is aware, that pattern interrupt, where they start practicing like, holy cow, I am constantly freaking out. I need even just a few moments of breathing or looking out the window. So I'm teaching them to pattern interrupt throughout the day, the constant worry. And I teach them that worry is a way of feeling in control. Even though it's negative, it's actually a way of controlling the situation. From there, we move into a little bit of vagus nerve toning before brain retraining. And that is getting your capacity to shift your emotional state more on board. Because actually, when you go from a state of fear, it's not easy to shift into a state of safety or calm, because the nervous system feels safe feeling fear. You have to slowly teach the nervous system to feel safe feeling safe. Sounds so crazy, but you have to incrementally do little practices of safety, like that physiological sigh or heart math breathing or other vagus nerve toning practices to show the nervous system that the parasympathetic rest and digest is okay. Because what happens is when you get these infections, your body feels safer in a war. It feels safer in the sympathetic dominance. And you've got to very carefully introduce more capacity into the nervous system for parasympathetic activity. From there, we move into brain retraining when they've got a little bit more of a container to shift in and out of sympathetic and parasympathetic. And the brain retraining practice is, it can be a little tricky for people, but it's about finding past positive memories and rehearsing them in positive future ideas and hopes, and rehearsing those. And so what you're doing is you are showing the brain, the amygdala, safety through memory and safety through future forecasting, because the whole limbic system is actually run on our memory structure, which is usually negative, especially when we've gotten sick. Our memory, our protective mechanisms like to rehearse what happened that was bad, so that we're protected in the future for what might be bad. And it's a loop of past was bad, future is going to be bad. And we have to break that loop. So we have to go into the past and do creative visualization and purposely remember and rehearse and speak about past times that were positive, so that we can open up the files in that hippocampus center and start accessing a different program for the amygdala to expect a different type of future. And that's a real challenge with people who've been in trauma. They're like, no, there's nothing positive. It's there. It's just buried under a lot of rubble, and we have to look for it. In the future, same thing. You have to train the brain to expect a positive future. You have to give it a sense that things are possible to change. And then what happens is when the amygdala gets these signals of safety, it sends a different signal to the hypothalamus, which sends a different signal throughout the whole body. And you'll get a shift in your biochemistry and endocrine function and hormones, etc. So it's a lot of mental rehearsal exercises, interrupting patterns, and willingness to see a different identity. And that's the big leap, the willingness to see the different identity. But the research shows that it's super effective. And so, we have people practice that every day. And I say, you got to give it 6 months. If you've been sick for a long time, you'll start to feel better. I felt drastically better in a few weeks. In 6 months, it was a turnaround after 10 years of chronic illness. But that is the basic of the first steps. And from there, we go into more emotional processing, because brain retraining is not the same as emotional processing. Emotional processing is more of a body-based somatic practice. It's really difficult to process painful trauma emotions if your limbic system is really hot and overactive. So we use brain retraining to turn down the dial of the limbic system before doing somatic processing and trauma processing for best results.
And so tell me about that.
So trauma processing has to do with somatics, which is basically the awareness of the body's felt sense, the felt experience of the body, because trauma actually gets lodged in the body. It's literally in our cells. And when we start to process trauma, our body starts to release emotion and starts to release sensation. If the limbic system has a protective strategy against feeling those sensations and emotions, because the memory center has tagged them as dangerous, it's very difficult to process trauma because the limbic system is going to try to shut it back down. That's why we address the memory center and why we address the limbic system. We need the limbic system to say, it's safe to feel anger. It's safe to feel grief. It's safe to feel these things because I'm able to also feel joy and peace and calm. And so emotional processing is literally being present without resistance, the felt sense in the body as those emotions and memory structures start coming to the surface, without having the limbic system making a story about it to put you back into resistance. Feeling the feels and not thinking the story. That's the key to emotional processing. And so there's a lot of practices to feel the feels and get out of the story, dropping into the body and observing as a curious observer. And every time the limbic system starts making the story about what they did or how you were victimized and all the things, we interrupt that. We're like, not right now. I'm just going to feel the felt sensation in my body. And that takes some nervous system capacity to do so, which is why we don't go right into that step.
How long did it take you from when you had that debilitating chronic phase to working with Dr. Kat to feel better?
I mean, it took me 12 years, and I'm consider myself one of the lucky ones with this. Some of the programs out there like Primal Trust, which is Dr. Kat's business and an educational program and all that. It's harder than you think. It is not easy work. It may sound easy to oh yeah, just mind over matter, think different thoughts, breathe. No, it's a commitment that it's literally retraining so many generational thoughts. I mean, you may not even realize that your own grandmother walked around going, oh, here it is again. And la, 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 la. And I can't feel better. And my knees and my back and all this stuff. But it's true. You kind of own that genetically sometimes. And it's really hard to just move past this. And I would definitely say to anybody out there that if you have these types of ruminating thoughts and this sort of constricting, or if anybody's ever told you before, do you want to even get better? Like, there's a lot that's packed in there because Lyme disease definitely holds you down for so long. But the Primal Trust Academy is really the way to go. And it's all online too.
Great. So that's why we'll have a link to that in our show notes. And we're going to have a link to Alicia to your, thetickchicks.com. Okay. So this is amazing, both of you. I think we've learned so much on this podcast. I guess I just want to end, Alicia, what's the best advice for someone newly diagnosed with Lyme's disease?
I think for anybody out there listening that suspects they have Lyme disease or has recently been diagnosed with it, just to, keep your brain forward focused. Keep knowing that you're safe. Keep knowing that your body will remember, and keep remembering that you can heal.
And do you feel 100% now?
Yeah, I feel 100%.
Oh, that's amazing. Dr. King, what is one daily practice that you will never skip for your nervous system?
That's so hard. I have so many. The truth is that our breath is the quickest way to regulate the nervous system, and the most direct feedback loop from, our brain to what's happening is how we're breathing. And so I think it's really important, especially if we're busy, in between calls, like how I showed you that physiological sigh that's been well researched by Huberman Labs. That's a really good one, where you take a breath in, another breath in and exhale. Or if you just click a YouTube video and you write heart math, quick coherence breath, the Heart Math Institute has all of these really simple short breath patterns. You're like, I only have 5 minutes. Just YouTube video, heart math, quick coherence breathing, and then just guide you through it, which is just a heart-centered breath where you're at the same time thinking of something you love, appreciate, or have gratitude for. And that also has shown to be such a quick biohack of the autonomic nervous system, and is kind of a form of mini brain retraining. So breath work, even like you just said, sometimes like I'm rushing, in between calls, I'm just going to take 3 deep breaths and just feel into something I love. And that right there is just a pattern interrupt. So that's what I would say is you start with the breath. I also just really want to say, I believe that the core, whether it's autoimmune or Lyme or mold, and I know this from working in my community, is that despite those diagnoses, working on the nervous system is the root. It's the root of all of them. And so in some ways, I don't say that it doesn't matter, but I've seen people that with all of those just focusing on these tools, because regulating the nervous system regulates all of those pieces. And so instead of freaking out which rabbit hole, do your best to get, the support you need, but know that your nervous system is a root for all of these conditions. And so you can't go wrong by focusing on that. If you're not sure what's going on, you're having a hard time getting diagnosed and figuring it out, what I know is going on is I'm sure that the nervous system needs some support. So start there.
That's amazing. Okay, so how can everybody find you too? Dr. Kat, how can everyone find you?
So I have a website called primaltrust.org. And I always like to share, I have this book that I wrote for free that you can download that's just beautiful on my website. It's called How Healing Happens. It's under the free resources section, and it's 130 pages with lots of beautiful graphics and exercises for free. The science of everything I teach, I do it in a nutshell. It's like a free mini program to really get a good understanding of what's happening, all the way from cell danger response to the vagus nerve to the limbic system. You'll learn about all of that plus exercises. So it's a great way to check out me, what I do, primaltrust.org, free resources.
We love a free resource.
Yeah.
And then Alicia.
And so you can find me at thetickchicks.com. And once you're there, you'll see my podcast episodes, which is called Lyme Time. I have over 100 episodes with 100 different experts that teach many, many different ways of healing Lyme disease, from conventional to integrative. Love that. I also have a resource page. I have my own booklet that I've just compiled from, it's a peer-to-peer resource guide for health practitioners across the nation who have dramatically changed the course of Lyme disease patients. And you can look up your state and find some resources there. And I'm on virtually every platform at the Tick Chicks.
Amazing. So, guys, thank you so much. I think, anyone suffering from any kind of autoimmune or just suffering from anxiety, depression, all of this, I think that this will be really helpful. So, thank you for joining me.
Thank you so
Thank you.
much, Mary Alice.
I brought back Alicia White of the Tick Chicks. I wanted to do an episode on Lyme disease for a very long time. A few months ago, we recorded an episode on Lyme disease, how to prevent it, what it is. We went really deep into the weeds. But lately in the news, I started hearing about a new tick-borne illness called alpha-gal syndrome. I wanted to bring back Alicia White from the Tick Chicks to dig deeper into the tick-triggered condition that is known as alpha-gal syndrome. We brought it up briefly on the previous recording, but I wanted to bring it up on the podcast again because it's been hitting the news in a huge way. Alpha-gal syndrome is not Lyme's disease. It's caused by the Lone Star tick, not the deer tick. Alpha-gal syndrome can make you severely allergic to red meat. In severe cases, smell or cooking fumes may trigger anaphylactic shock. The CDC estimates up to 450,000 Americans are affected, and the Lone Star tick range is expanding northward due to climate change. I also wanted to touch on a regenerative therapy called TrueDose that has been helping chronic Lyme disease patients find relief when nothing else has worked. So I have my gorgeous friend Allie here, and we shot this episode months ago, and we wanted to launch it during May for Lyme Disease Awareness Month. But you and I were talking in the car the other day, and you said, Miros, we touched on it a little bit, but we have to talk more about alpha-gal syndrome. And this sounds like alpha-gal syndrome. That sounds like a great, amazing thing to have, but it's a major issue right now. Tell us what's happening, what's going on, and why you thought this was really important to dig into this a little bit more.
Yeah, I mean, it is a rapidly emerging crisis in our country. And most people have never heard of alpha-gal before. I bet you hadn't heard about a meat allergy, but currently it's the 10th most common allergy in the United States. So think of all the little kids and the chefs and everything that this thing can potentially hurt. You run up against a tick, it's so small, you don't know it, but it could be life-changing. And alpha-gal can be fatal.
What happens? So you get bitten by this tick and then you become just deathly allergic to meat? Is that what it is?
Basically, right now in the United States, it's estimated to be affecting 400 to 500,000 people. Now, when you go into the ER, you have to disclose, oh yes, I have this allergy when you're listing your list of allergies. And so for 38% of the population to be having this now over the past 8 to 10 years, it used to be 1.8%. Now it's 38%. I mean, it's unbelievable how this is emerging. And why is it emerging this way? But yes, so let me just kind of break it down for you a little bit. Alpha-gal is a sugar molecule that mammals have, but humans don't. So if you have a carrier, like a tick, that feeds on, let's say, a deer and then bites you and transfers that sugar molecule to you, you can have this, what's called an alpha-gal allergic reaction. But unlike Lyme is a bacterial infection. Alpha-gal is actually the onset of an allergic reaction to meat, dairy, and believe it or not, mammalian products are found in capsules that you might be taking for your supplements. It's found in gelatin. It's found in some brands of toothpaste. So it can very rapidly, within 6 to 8 hours, affect your entire life just by one little tick bite. So it's not really the tick. There are several ticks that carry alpha-gal, but it's more the fact that you're being introduced to a molecule out of nowhere and all of a sudden having an allergic reaction to it. And it's a severe allergic reaction.
Like anaphylactic shock, sometimes just smelling meat.
That's right. I just was at a speaking engagement not too long ago, and one of my girls there said, yes, I have it, and I can't even drive with my windows down. If I drive past a barbecue restaurant, I will start anaphylactic shock. And so EpiPens are big in this community. And you'll see a lot of people in the states that are being affected. Basically, their option is to go vegan.
Wow. Oh my
So it's
gosh.
anything fins and feathers
Yeah.
are okay. And so it's a misnomer to think that it's a bacteria. It's really not. It's an actual allergic reaction, like a bee sting for some people.
Okay.
So it's also fairly slow moving, which is why it's hard to know that it's an allergic reaction, because you could have dinner and have a hamburger and then wake up at 2 a.m. and sort of start vomiting or feeling really bad and all of that. But you may not be putting that connection together at all, much less with the tick bite that you just had.
And there's no cure.
There's no cure right now. There are some promising treatments, but the best thing that you can do is prevent.
So the other thing I wanted to talk to you about since we've shot the first episode, was there is an integrative approach to treating Lyme's disease, and it's called TrueDose PRP therapy. It's a platelet-rich plasma intravenous therapy. Now, this is not standard of care, so I want to just say that right now. But have you heard about this? What are your thoughts on it?
Yeah, there's some great new treatments coming out on the Lyme forefront that we're excited about. I've even tried one of them. And just like this, basically it can go into your body and actually use your own body's formulation and DNA to help correct itself. So they will basically enhance what you already have and have those platelets and even your DNA strain work for you as opposed to against you. So you're basically taking your blood out and your platelets out and fortifying those and putting them back in your body to do, great things inside.
So when I was researching, it says it aims to modulate the immune system and reduce systemic inflation in chronic conditions. So people with autoimmune can also take it. Do you consider Lyme disease an autoimmune disease?
It's debatable.
Okay.
So I want to put that out there right now, because what happens is Lyme disease basically enters your body as a bacteria, and it's a very slow moving bacteria, and it basically moves all around your body. It could affect your kidneys 1 month, and then your knees the next month, and then your brain, and it can go to your heart. So it's a very sort of stealth bacteria. And what it does is in its path, it leaves your immune system in shambles.
Right.
So we are getting closer and closer to labeling it as an autoimmune disease. But right now it is probably, I would say technically not, but it creates the systemic breakdown in your body that very much
mirrors an autoimmune disease.
Absolutely.
Yeah.
And it's chronic in about 60% of the cases. So it is acting as though it is an autoimmune disorder, and it can be long lasting.
In our previous interview, you talked about your 12-year battle, that you were misdiagnosed, that you struggled to figure out how to make yourself better. Really explain it as you felt like you were just dying. You couldn't get out of bed. And you just brick by brick built yourself back up. And so now, in terms of some of these new treatments that you're hearing, do you feel hopeful? I mean, now we're scared to death. We have this new
Alpha-gal.
illness, the alpha-gal now, that sounds like a really good name, but really is a terrible
Should be a
name.
sorority girlfriend.
Yes, it should be like amazing girl power. Do you feel hopeful? I mean, I want some hope, and I want to give our listeners some hope.
Yeah, I do. And the more we can inform, and the more people can be preventative when they go out and enjoy Mother Nature, that's the best thing we can hope for right now, is that people just get smart and don't learn about it after the fact. But I was just on a private coaching call with one of my clients, and she said, wow, did you try this treatment and that treatment and this treatment? I said, no, 15 years ago,
There was nothing.
nobody was talking about this. This is why I started the Tick Chicks,
Yeah.
because I had nowhere to turn for answers. So now there's a lot out there. So I'm increasingly, hopeful, because the word is getting out. Now with Alpha-Gal, sadly, it's creating a buzz where it's on everybody's radar. It's tick season, and so I'm hopeful for that. And I do believe that the research is going to give us some amazing treatments that are moving the needle for these patients. It's sort of like long COVID. Some people go through it for a period. Mine happened to last 12, 13, 14 years. But, it was like a bell. And eventually I got out of it, and
and other people can too. It's just about knowing exactly what to do, knowing how much your body can take at what state of the game. When you're in acute stage, you can't handle a lot that you can in the third stage, which I call maintenance stage. So you pick and choose, you try again, you become your own advocate, and you empower yourself, because the doctors just don't know more than you do about your own body.
Right. As we wrap this up, can you give us, it seems like there is no cure for both of these, but it's just about prevention. And there are treatments for the symptoms and how to get yourself out of it. But how do you prevent getting Lyme's disease or alpha-gal syndrome?
So first, you start in your yard. You start in your own surroundings. You start treating your grass and your wood piles and your gardening areas and things like that. Then you treat your pets. You have to wipe them down with different, tools. There's something called a tick mitt. It's like a little mitten, and you just rub them down and they love it. But it gets off those ticks, because the ticks can actually live in your home for 3 weeks. In your carpet, on your bed, whatever. So if you're an animal lover, those ticks are coming into your home. Okay. Microscopic ticks, by the way. And then the third thing you can do is just take matters into your own hands. Pay attention to your lifestyle. Maybe cut out 1 meal a day to give your body a break. It's on overload. You can do many, many at-home treatments that are very affordable, and just to bring your body relief for that time. And just keep working at it. Get your team together. There's, I didn't have one doctor that helped me get better. I found healing through having a team, which I got over, 5-6 years. And I just found the best of the best. And this person would handle this, and this person I went to for that. And I just pieced it together, because there wasn't one doctor that was that Lyme literate at the time. But there are plenty of resources. There are peer-to-peer support groups. I have a podcast with over 100 episodes with all the experts, and it's free advice. Yeah. Put it on when you're taking a walk or something, and just really, really just take matters into your own hands. You're stronger than you think.
So how does everybody find you? Because you have all this information that you have gathered over, you're now an expert. We always say this too, it takes something that you think is going to destroy you to actually change your life and give your life a purpose that you had no idea. And you've made this your life mission. You want to help everyone that suffers. So how does everybody find you?
So they can go to thetickchicks.com and see me there. And from there, they can find my podcast, which is Apple, Spotify, and YouTube. It's called Lyme Time. Okay. And again, I just talk to all the experts there, and we talk about all the different ways to heal, from expensive to things you can do at home. So cover it all. And that's, I'm on Instagram, Pinterest, Facebook.
Okay, great.
It's all the Tick Chicks.
All right. Well, you're the best. Thank you. Thank you for coming back. We cannot launch this episode without talking about this. It's in the news. It's everywhere. And apparently because of global warming, it's really growing. So
Yeah. I mean, and urban development.
Yeah.
Our cities are moving out into these forested areas, and it's easier for them to hitch a ride.
Okay, so prevention. That is the key.
That's
so
it.
Thank you,
Be
Allie.
smart and safe, and be really, really preventative with your children.
Thanks so much for joining us today on SheMD.
If you want to own your own health, a good place to start is by following us on social media at SheMD Podcast, and by subscribing to our show on YouTube or wherever you get your podcasts.
For takeaways from today's episode, visit our website, shemdpodcast.com. We'll see you next time on SheMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SheMD, some of the products and services we discuss may involve sponsorships or paid advertising.